When I thought I was done with university, I'm going to take 2 minutes more than my allocated time. When I thought I was done with university, I turned to him for a job in the editorial of the EPW. And of course, I thought I knew how to change the world, and I was going to be the person to change the world. And I said, give me a job in the editorial of the EPW, and I will spend time working for the trade union, and I was going to do a few other things. And he said to me, go back, take time off, make up your mind, there's only one thing you can do well, and go and do that well. If you've decided what you want to do is write editorials in the EPW, and that's all you want to do, then come back to me. I showed up many weeks later to tell him that I had become a whole-timer in the trade union, and he took me to the press club for a drink. I've never regretted that decision, and amongst others, I remain deeply grateful to him for this. I have to say that both papers were extremely robust, and certainly in academic discussion, the task of a discussant is to try and tear them apart. But when you agree with them is when you wonder why you accepted the invitation. When I began as a student of economics 25 years ago, it was very common to compare the big Latin American countries in India. They were all economies that had been built around a digest tradition. They were built in a framework of import substituting industrialization. They were built in a framework of protection. They were built around the non-aligned movement. And they were all in one form or another poor. I think what we've heard this afternoon, and something I've been very conscious of for some time, that some in that pool have climbed quite a way up that mountain. And that's what Dr. Negri told us this afternoon. What Dr. Reddy told us is, we still have the mountain to climb. I dare say he left me with the feeling that it's going to be a very difficult mountain to climb. And I think when he said we have to struggle, I think we really have to learn from the experiences around us to look at the challenges. Biplab Das Gupta, the late member of parliament, went on a parliamentary delegation to Brazil about a decade ago. And he came back and he said, I brought a lot of photographs. And I want people to see what Brazil is like, because most Indians think Brazil is about black people who play football. And I think one thing that we have to do in the Indian progressive community, and I think that's a lesson of this afternoon too, we need to open our eyes to the world. There are countries and people and nations that are making strides, and they're making strides by beating globalization, by beating imperialist globalization, and we're not open to them. And I come from the left, and I think this is a problem with the entire progressive community. We believe we've got it right, we know how to get it right, and we're going to get it right by bringing about a socialist revolution. We have to, I think, face up to the fact that we're not on the cusp of a socialist revolution. We have to face up to the fact that we are not, when we wake up tomorrow after these wonderful lectures, build the complete, perfect, comprehensive, publicly owned, publicly delivered universal healthcare system. And I think that's what the two papers are telling us. One told us how they achieved it without deluding themselves. The other told us how deep that challenge is. But I think there were some fundamental philosophical issues that came up, and I think those are also very important in our debate in this country. I think the fundamental issue is of universality. We talk about universal healthcare. We think we know what we mean by universal healthcare, and I think we know what we mean by universal healthcare. But do we as a society, as a progressive community, imbue in us the political philosophy of universality? Today we've come to the point where we agree that we need universal healthcare. But I sit on other campaigns and around other tables. I did a few months ago and continue to do on a campaign for the public distribution system. And from within the progressive community, friends and comrades said, but government employees can't get PDS. So-and-so should not get PDS. I think the harsh reality is universality is a progressive principle. Exclusion is a regressive principle. And just because somebody is better off, let's not lose sight of what we're seeking. And I think we really need to, in a very deep, fundamental political sense, imbue in us. Yes, there's the economic data, there's the data of economic administrators worldwide, which now tells us, and of course a wonderful study of PDS from the 1990s or from this state, which tells us universality beats everything else. And I think we really need to imbue that, but not just as an economic category, as a matter of efficiency, but as a fundamental political philosophy, as a core philosophy of our politics. And I think that's really something we need to put our energies on. Beyond this, I think there are two things where we need to move the burden of this debate. I think from what Dr. Reddy said, it's very clear, and many of us know that, but he put it out extremely well. We need to move the burden of this debate from tertiary and secondary care to primary care. It's not just about urban and rural. Yes, there's a huge urban and rural divide, but there's an enormous and profound primary healthcare deficit. And that deficit has to be filled. That deficit has to be filled in more ways than one, and we need to look at a roadmap as to how to fill that deficit. Part of that, I think he talked about integrating systems. We need to look at the entire gamut of healthcare framework systems in this country as to how we're going to integrate that. But I think there is a fundamental point about financing, and I don't think, and I'm a trade unionist, and it's my job to be bothered about financing. I have been balloted against by membership who wanted out of the ESI. They wanted the wage package to be computed in a way in which they went out of the ESI, the Employee State Insurance Corporation threshold. Okay, and this, I think, is the case with most formal sector unions today. We are under pressure. Dr. Negri talked about the debates that led up to 1988. We are under pressure from within the formal sector to retain existing systems, both publicly and privately owned. We are under pressure from our membership to hold these systems together. And I think that's also part of the challenge of integration. But I think we have I think these are only small pegs in that. I think we're equally under pressure from private practicing doctors. We're under pressure from doctors in the public health system, such as in the state of Tamil Nadu, who have the right to practice privately, and some of them make industrialist proportion wealth. People must think that this gentleman is foolish in this country, a specialist cardiologist. I mean, cardiologists in this country literally have industrialist proportion wealth. So these, I mean, but all of this finally comes down to, do we find a balance between contribution, between insurance, and between taxation? And I think the balance of that rests with taxation.